Alright. It is Monday, March 2nd, 2020 at 11:19 p.m. Alright, guys. So, let's go first into the articles. Alright. 2 coronavirus cases confirmed in Georgia. This just recently came out. Governor Brian Kemp on March the 2nd confirmed that there are 2 coronavirus cases identified in Georgia. Kemp called a press conference at 10 p.m. on Monday evening on March 2nd to announce the news. We have 2 confirmed cases of COVID-19 in Georgia, Kemp said during the press conference. 2 individuals who reside in the same household, once recently returned from Italy. Both are isolated at home with other family. Georgians should remain calm. We were ready for today. We have been preparing, as we know, for several weeks. Every development has come forward just as we expected it would. Georgia Department of Public Health Commissioner Kathleen Toomey said officials learned about the cases hours before calling the press conference. She said the 2 identified cases were in Fulton County. She said the person who was infected had been to Milan. You more likely have to have encountered coronavirus there than in Georgia, she said. So there's 2 cases in Georgia. That's kind of close to home for me since I live in North Carolina. That's a couple, like right there. So, yeah, let's talk quickly about the what's been happening since the last video I made. Well, basically, people have been not fully panic shopping, but a lot of people have been, especially people in Washington State, and California and Hawaii. They've been shopping more to stock up and panic buying in those states, but in the rest of the country, it's some people are awake enough that they're shopping more for stocking up and just in case there's an emergency of a shutdown or something. I've been stocking up. We stocked up in our groceries, and I just came today. We stocked up in our groceries a couple days ago, but today I went and got 2 more bags or packages of toilet paper rolls, even though I already had some. I just wanted to make sure that we had enough. And then I got more bleach. And then I stocked up on a whole bunch of Asian sauces because we like the teriyaki, the sweet and sour, all these type of sauces. I was stocked up on plenty of those so that we'll have enough for a while. So pretty much the people have been stocking up. The cases where more people are passing away has been happening in more towards the West Coast and Washington State, but it's been pretty much not calm, but you could see in the faces of the people that I went shopping, some people are aware that there's a possibility of an emergency coming, while some other people are just going about their regular business. So I haven't seen any real panic, but I just wanted to report that. Alright, let's go to the next article. 2 cases of coronavirus confirmed in Metro Atlanta. Atlanta Governor Brian Kemp confirmed at a late-night news conference Monday that there were 2 confirmed cases of COVID-19 in Fulton County. The Centers for Disease Control and Prevention confirmed the cases to state health officials earlier in the evening. These cases involve 2 individuals who reside in the same household, one who recently returned from Italy. They are currently being kept inside their home with their family to help isolate the virus. The governor urged residents that there is no reason to panic about tonight's announcement. Georgians should remain calm. We were ready for today. We have been preparing for weeks on, and so far, every development has come forward just as we expected. Kemp said the newly formed state coronavirus task force played a big role in being proactive in this case. We thought it was important that we come home and tell you about this, even as our epidemiologist had said still investigating and finding any potential contacts in the community. So the Department of Public Health Commissioner Dr. Kathleen Toomey said. Toomey praised the patients and physicians in how they handled the cases. She said the man who had returned from Italy called his doctor complaining of symptoms. She said the doctor had two patients enter through separate entrances to the doctor's office and kept them from as much exposure as possible to other people. We got the specimen on Saturday, sent it to the CDC for testing because they are the ones doing the test currently, and they turned it around in record time, Tommy said. Tommy said the patient did not experience any symptoms until they returned back home to Metro Atlanta. She says the patients and their family members are being isolated inside their home, are doing well, and showing minimal symptoms. We will continue to search for any contacts to ensure that we stop any further spread in the community, Tommy said. We do not want that to go any further. The message to the public: it's still low risk, no local transmissions going on, and wash your hands and get a flu shot, Tommy said. Alright, so that's pretty much the summary of that article. Let's go next to coronavirus clusters near Seattle highlights vulnerability of nursing homes. This is what I was talking about earlier. The nursing homes and the elderly people who have been having contacted with coronavirus, it could spread in the nursing home, and it could pretty much, since they are of age or of older age, they have more susceptibility to becoming ill. So let's read the article. It says here, an outbreak of coronavirus disease in a nursing home near Seattle is prompting urgent calls for precautionary tactics at America's elder care facilities, where residents are at heightened risk of serious complications from the illness because of the dual threat of age and close living conditions. As of Monday afternoon, the emergence of a novel coronavirus illness at the Life Care Center in Kirkland, Washington, has left 4 residents dead and others hospitalized. Local health officials said a healthcare worker also has been hospitalized. In total, Washington state has reported 6 deaths, officials said. Officials previously said that the nursing home's 108 residents and the 180 staff members, more than 50, have shown signs of possible COVID-19 infections. Okay, so more than 50 have shown signs of possible COVID-19 infections, while there's 6 deaths. So that's pretty much a small pocket of a lot of people being sick right there. The name given illness caused by the novel coronavirus that emerged from Wuhan, China late last year. Visits from families, volunteers, and vendors have been halted, and new admissions placed on hold, according to the statement from Ellie Basham, the center's executive director. Current residents and associates are being monitored closely, and with symptoms or who are potentially exposed are quarantined, she wrote. The cluster of illnesses, the first type in the U.S., where 2.2 million people live long-term care settings and may be at heightened risk because of age or underlying health conditions. We are very concerned about an outbreak in setting where there are many older people, said Jeff Dushin, health officer of Seattle and King County Public Health Agency. The American Healthcare Association, with residents, which represents 13,500 nonprofit and for-profit facilities for seniors and disabled people, issued updated guidelines Saturday in response to the Washington outbreak. The new virus is thought to spread primarily via droplets in the air, and the guidelines largely echo strategies recommended to stem the spread of other respiratory viruses such as influenza. This includes frequent hand sanitation among staff and visitors, grouping people who become ill in the same room or wing, and asking family members who are sick to avoid in-person visits. But members have anticipated the cases of the virus, so it's pretty much just signaling that nursing homes could be a possible vulnerability because of the coronavirus, because of close living conditions and of dual threat of age. So that's something to look forward to when it comes to this possibly spreading more and affecting other areas of the country. When it does happen, that's something to keep in mind to take care of our elderly people. Alright, next. Coronavirus outbreak, U.S. confirms cases in Chicago and Rhode Island. Healthcare Secretary, we will see continued community spreading. Okay, that's something else. U.S. Health Secretary Alex Azar has confirmed a new case of coronavirus in Chicago as the respiratory illness spreads in the U.S. Also on Sunday, Rhode Island announced its first known case. The new cases came after Washington State confirmed a man in his 50s died from the respiratory illness, first known death caused by coronavirus in the U.S. Azar told Fox News on Sunday the Chicago case was one of the 23 to be diagnosed in a person who had not been repatriated from Japan or China. Of those individuals, we've got cases in Chicago, as well as Washington and Oregon, and 2 in California, where we do not yet know where they contracted the novel coronavirus. Alright, so that's something that's increasing now, is people who have not either come from China or that they can't track or trace where the coronavirus has come from. It just appears out of nowhere. They don't have any connection with anybody who's come or traveled, so it just pops up, and now there's more people having it that way. So I just wanted to go over those articles and ask for prayer for these people who are sick, and ask for prayer for the people who are in the nursing homes, who are more than 50 people possibly sick, and 6 who have just passed away. So I'm asking for prayer for those people. And I'm going to go over now a list of 100 items that tend to disappear first once you start stocking up. It says here, top 100 items to disappear first. You could also call this the top 100 things you should start stocking up on. Even if you don't need more than 2, you should always have 2 of everything. Each item on this list will be great for bartering. This list was discussed and chosen by the members of survivalcash.com forums, in no particular order. Alright, so number 1 is generators. Number 2, water filters and purifiers. Number 3, portable toilets. Number 4, seasoned firewood. Number 5, lamp oils, wicks, lamps, and lanterns. Number 6, camp stove fuel. Number 7, guns, ammunition, pepper spray, knives, clubs, bats, and slingshots. Number 8, hand can openers and hand egg beaters and whisks. Number 9, honey, syrup, wine brown sugar. Number 10, rice, beans, and wheat. Number 11, vegetable oil for cooking. Number 12, charcoal and lighter fluid. Number 13, water containers. Number 14, mini heater head. And number 15, grain grinder. 16, propane cylinders. 17, survival guidebook. 18, lantern mantles. 19, baby supplies. And I'm going to read up to 25. Washboards, mop bucket. 21, propane cook stoves. 22, vitamins. 23, propane cylinder or handle. 24, feminine hygiene products. And 25, thermal underwear. I'm going to leave the link for the rest of it. The reason why I brought it up is because it's something important to keep in mind once you're prepping, or if you're storing things and the things tend to disappear after a while. You either lose them or you've used them, and they're just a list of 100 things that seem important if you're prepping or stocking, because of any emergency. When it comes to prepping, it doesn't have to be just for the coronavirus. It could be for hurricanes, preparing for any emergency. It's good to always be prepared. Alright guys, hit like and subscribe for more videos, and see you next time. If there's any updates on the coronavirus that I find interesting, I'll make a video on it. Make sure you check out in the description below Dave's Empire 1981. He pretty much has awesome art stuff like shoes and hats that he makes art on. So check him out. Alright guys, see you next time. God bless.